said nothing, nothing, he has nothing. And simply that did not add up to me.
Why is that?
Doctors in the house, IV pole, IV hooked up to the patient. It didn't seem normal.
Drapes drawn in the residence, in the bedroom where you were in?
Frankly, I don't recall.
So you're assessing the scene, and the information that you're receiving from Dr. Murray isn't making sense to you, correct?
That's correct.
Did you ask Dr. Murray how long the patient had been in this condition, or how long the patient had been down?
I did ask him that.
What did Dr. Murray say in response to that question?
It just happened right when I called you.
And in your mind, what did that mean in terms of timing of this patient's present condition?
It meant to me that this was a patient that was somebody we had a really good chance of saving.
Why is that? Does it relate to the timing?
It definitely relates to the timing. It comes down to if he called us right when we got the call, I knew we got there very, very quickly. It means that we're going to be able to have a good chance at restarting the heart, if that's the...
Your Honor, may I approach the witness stand and retrieve an exhibit?
Certainly.
Mr. Senneff, I would like to put people's number 43 back on the overhead projector and ask you some questions pertaining to information contained on that document. May I have the lights, please? Thank you.
You're welcome.
Mr. Senneff, you told us that you're calculating the time that you received the call, which you told us the time that you responded out of the station was what time?
12:22.
And does People's Number 43 permit you to describe the time that you are at the patient making the observations that you've just described for us?
Yes, it does.
What time is that?
12:26.
So basically 5 minutes has elapsed from the time that you received the call for distress and the time that you are physically with your eyes on the patient. Is that correct?
Yes.
After you enter the room, is the patient's body repositioned into a different area to permit you and the other rescue individuals to provide treatment to him?
That is correct. When we first walked in, the patient had been placed on the floor next to the nightstand, and there's just no room to work there. So one of the firefighters and myself moved the patient over to the foot of the bed.
And showing you People's Number 21 again, does this photograph permit you to show us where the patient is located to give you more room?
Yes, we moved the patient to this area here.
May the record reflect the witnesses indicating the area on the carpet at the foot of the bed?
Yes.
Mr. Senneff, using your laser pointer, would you show us where the patient's head was and the patient's feet were relative to this location at the foot of the bed?
The feet of the patient would be right here. The head would be over on this area here.
May the record reflect the witnesses indicated that the patient's head would be to the far side of the bed, the feet of the patient would be at the area closest to the entry to the bedroom, still at the foot of the bed, and that would be parallel to the foot of the bed, correct?
Yeah, that's correct.
So at this time, are you still following up with Dr. Murray trying to obtain underlying medical condition information?
Yes, I am.
And you told us that you asked the question approximately 3 times, and Dr. Murray's response was he has none, correct?
That's correct.
Presumably we put on.
Yes, thank you, Your Honor.
Thank you.
What else is going on in terms of efforts to treat the patient at the time that you're peppering Dr. Murray with questions regarding the patient's medical condition?
As I'm asking Dr. Murray the questions, the other members of the team are springing into action, if you will. Firefighter Heron is starting CPR. Paramedic Blunt is starting ventilations and the intubation procedure. Paramedic is hooking up to EKG. Our captain is helping wherever he can.
So it's you, Heron, Blunt, and Goodwin, all hands-on trying to help the patient, correct?
That's correct.
At this point in time, have you recognized the patient as anyone that you're familiar with?
No, I haven't even looked.
You haven't looked at the patient at all?
No, I've looked at the patient, but I didn't really look at the whole face. I was busy.
At some point, did you learn that the patient that was on the floor that you were treating was, in fact, Michael Jackson?
I did.
Heron is doing CPR. Describe that for me, please. What you observed.
Standard. He's a big, strong man. He leaned over and started doing chest compressions immediately.
One hand or two-handed? And you said that Blunt, your partner who drove the rescue ambulance, was ventilating. Describe what that means, please.
We have an ambu bag, a BVM for bag valve mask, and ventilating the patient. You seal the mask over the face and you squeeze the bag.
What's the purpose of squeezing the bag over the patient's face?
To push air into the patient's lungs.
Did that procedure happen immediately upon the care rendered to Mr. Jackson when you all arrived?
Yes.
Is that critical? Get air into the airways right off the bat?
Yes.
And you told us that your colleague Goodwin was connecting an EKG, correct?
Yes.
Describe what that is and why it's important.
The EKG is the life pack monitor. That's the thing with the picture on it that you see what the heart's doing. It's got 4 leads, cables that attach to the patient via stickers. So he's placing the stickers on the patient so we can find out right off the bat what cardiac rhythm the patient is in.
And you're indicating touching your chest area. Would that represent where the patches are placed on Mr. Jackson's body in order to have the EKG machine properly connected to provide readings to you?
Yes.
And when the EKG machine is connected and taking a reading, what information would be conveyed through that EKG machine?
The EKG machine shows the electrical activity of the heart.
Would that mean whether there's a heartbeat or not?
Yes.
And if there's not a heartbeat, is it a flat line?
Yes.
Did you look at the EKG machine once it was hooked up to Mr. Jackson's chest?
Yes, I did.
What did you see on the screen?
Asystole,
What does that mean?
flat line.
The machine, the EKG machine, is it a portable machine? You obviously carried it up to the bedroom with you, set it down, hooked it up to Mr. Jackson, and got a reading.
Yes.
So at this point in time, your team has started respiration for Mr. Jackson with the ambu bag apparatus. You've connected him up to an EKG machine in order to determine if there's any heart activity. Are there any medications that are being administered to Mr. Jackson at this point in time?
It's all happening rather simultaneously.
I understand.
Mr. Jackson had a IV in place in his leg. That said, I tested the IV to make sure it would work. And when it did, we gave him some epinephrine right away and some atropine.
And what are those 2 drugs designed to do in the situation where you administered them?
Start the heart.
Once you administered those 2 drugs, were you expecting to see some change in his condition?
Yes.
And did you see any change in his condition?
No.
Are you still following up with Dr. Murray concerning any medications or health condition that might assist you in your life-saving efforts with Mr. Jackson?
Yes.
Did you ask Dr. Murray whether or not the patient was taking any medications or had been given any medications?
Yes, I did.
Did Dr. Murray provide you with an answer?
Yes.
Did he provide you with an answer right off the bat when you first got in and asked that question?
No, I asked a couple of different times.
Specifically regarding medications?
Yes.
And he initially didn't provide you with any information regarding any medications?
What I said initially, of course, was what's his underlying condition, and then when I didn't get what I felt was a satisfactory answer, I explained to him the reason I'm asking is because I see an underweight patient, I see an IV here, and I see medication vials on the nightstand.
In response to your questioning repeatedly regarding medications, did Dr. Murray provide you with information concerning medications?
At that point, he said, no, he's not taking anything, and then he followed that up with, I just gave him a little bit of lorazepam to sleep.
And lorazepam is a mild sedative, correct?
Yes.
Did you follow up with anything else, Dr. Murray? Are you giving him, or did you give him anything else?
Let me think. He did. I asked, was there anything else? Is there anything else? And no, that's it. Just a little bit of lorazepam.
Did Dr. Murray provide you with any information as to what Dr. Murray was treating him for?
Yes, he did.
What did he say?
He was treating him for dehydration and exhaustion.
And that's all?
That's all.
At this point in time, Mr. Jackson has received one round of the starter drugs. He's hooked up to the monitor. And did Paramedic Blunt take any other measures to assist with delivery of air to Mr. Jackson?
Yes, he did.
What is that?
He intubated the patient.
What does that mean?
That means he took a tube and placed it directly into the patient's lungs.
And the purpose of placing a tube directly in Mr. Jackson's lungs was to accomplish what?
Overruled. 801. You may answer.
The reason for placing the tube directly into his lungs is it's a clear ventilatory route. It allows the lungs to get a full expansive oxygen, air, that sort of thing.
Better than the ambu bag?
Yes, much significantly better than just placing the bag over the mouth. When you just place the bag over the mouth, it's common for air to go into the stomach too.
And when air goes into the stomach, it doesn't serve any respiratory effect?
No, and worse than that, the stomach will fill up with air and eventually it'll empty the stomach contents.
You are monitoring Mr. Jackson's progress or lack thereof during your resuscitative efforts, correct?
That's correct.
With respect to the intubation and airway management, are you measuring the success of that life-saving step?
Yes, we're listening to lung sounds, of course, to make sure that air is going into each lung. And then on our machine, we have a capnography device, and that measures whether the ET tube is successfully in place.
Once Mr. Blunt put the ET tube down Mr. Jackson's throat, were you able to have a reading as to the oxygen level of Mr. Jackson through the capnography machine?
That's right. The capnography machine measures the exhausted CO2 from the patient.
And what was the reading that you obtained, if any, once the successful intubation occurred?
Yes, the reading was 16.
Is the intubation process tricky?
Yes, it is.
Did Paramedic Blunt perform that intubation in a rapid manner?
Yes, he did.
How rapid?
I was very impressed how quick he got it in the blink of an eye.
Now, at this point in time, you've told us, based on the exhibit of the bedroom depicted in People's 21 that's on the projection screen